I'm Evangelos Terpos, Professor of Hematology in the National and Kapodistrian University of Athens in Greece. And my topic today is what you need to know about keratopathy for those patients with multiple myeloma who receive belantamab mafodotin. Belantamab mafodotin, or Belamaf as we call it in our clinical practice, is the first-in-class BCMA targeting antibody-drug conjugate containing monomethyl auristatin F, and it's a very good drug, very efficacious for the treatment of relapsed refractory multiple myeloma, especially in those patients who have received treatment with IMiDs, bortezomib, or anti-CD38 monoclonal antibodies, and they have failed on these therapies. One of the major side effects of Belamaf is the ocular symptomatology, including blurred vision, dry eye, and changes to the best corrected visual acuity score, as we call it, BCVA, and also keratopathy that includes superficial punctate keratopathy and microcyst-like epithelial changes that are seen especially on ocular exams. So patients who are under treatment with Belamaf have very often examination by ophthalmologists in order to be sure that they don't have these side effects. So severe keratopathy and diffuse microcyst-like epithelial changes were found to have the highest frequency in corneal exam findings in evaluation with grades 3 or 4 keratopathy and grade 0 to 1 visual acuity scores with no symptoms. This is what we describe in an abstract that we present in the ASCO meeting, where we present the scores that we can use in order to be able to manage, to have the patients, to distinguish patients with symptoms that they don't have the need of an ophthalmologist, and we can handle them as hematologists, or if they have specific symptoms and signals that they have to be treated by an ophthalmologist. The results of the analysis that we present in the ASCO suggest that the changes in visual acuity, ocular symptoms, and patient-reported outcomes should be further investigated as possible surrogate markers to help the hematologist and oncologist to detect meaningful keratopathy and inform them as to when it is best to consult an ophthalmologist for full ophthalmologic exam while the patient is on Belamaf treatment. So I believe that this is what the patient and the doctors need to know, that ocular symptoms happen rather often in patients who are under treatment with Belamaf, and we have specific scores that we develop them now, like the visual acuity score. And with that score, we try to find out, as I previously mentioned, who is the one that needs to be examined by an ophthalmologist. The first results, as I told you, are announced in the ASCO meeting, and we try to have them as a basis in order to develop an algorithm which is going to be very useful for the hematologist, oncologist, as I told you previously, to detect the meaningful keratopathy and send the patient to an ophthalmologist, and not all the patients as we are doing now.